Welcome to everybody who just joined. I think we might just wait one more minute to jump in to our agenda. Thank you all for being here on this Tuesday morning. Okay, I don't see anyone else filtering into the waiting room, but we'll keep an eye on that. So again, welcome. If you would just drop your name and organization into the chat. I'll go through the agenda for today in a moment, but we'll have a chance to connect and share individual program updates towards the end of our hour and a half connection meeting today. But if you would, yeah, put your name and organization in the chat, that would be awesome, just so we know who's in the room, especially if there are new faces. And again, just a little bit of grounding, since we often have different folks join these meetings quarterly. So this is the VeggieRx working group with the Oregon Community Food Systems Network, and we bring together people and organizations that are supporting VeggieRx style programs. So folks in the healthcare sector, folks who are program operators for these various food assistance programs, and policymakers, et cetera. And so this meeting is intended to provide a peer learning space for all of those entities I just mentioned. And really quickly, kind of what is VeggieRx? VeggieRx is a produce prescription program that's used as a medical treatment or preventative service kind of for health reasons for patients. And here are just two examples of what a VeggieRx program might be. Probably everyone in the room is already familiar with these, but again, just wanted to provide a little bit of grounding. So a VeggieRx might be a community supported agriculture share or CSA share, or a veggie box. Or it could also be a card or voucher to shop at farmers markets or participate in grocery retailers to buy fruits and vegetables, and sometimes other foods like nutrient dense and protein dense foods. All right, so today that was our welcoming and grounding. Shin is going to share some working group updates and Oregon Community Food Systems Network updates. And then myself and I think our other two steering committee members who are on the call are just going to do a brief reintroduction of ourselves. There's 3 steering committee members for this working group, and we want to make sure that we're familiar faces for everybody. And then we're going to hear a little bit from Theo Latta about OHSU's Towards Health, Towards Wellness program. I know that that's a working title, so forgive me, Theo, for popping that in there. And then we'll have a brief guest presentation from Kelly Randolph and Project Dash. Kelly's with Zenger Farms. They have a successful distribution partnership that we thought it would be maybe useful for other folks in the state to learn about. And then we'll have a program operator share out. I know Marci McMurphy with Frontier VeggieRx is going to share some organized thoughts. And then we'll have some time for other program operators to share updates or ask questions of the group. It's a great opportunity to get some peer support. And I'll hand it to you, Shin, and I will stop sharing my screen.
Thanks so much, Claire. And it's so good to see some of your faces. And I think I know everybody on here, but just for anyone watching the recording, my name is Shin. I use she, they pronouns, and I am the Executive Director of Network Development at OCFSN. And I'm going to drop into the chat because last week we sent out our February newsletter. And so just a little bit of housekeeping reminder that if you are not currently signed up for the newsletter, you can do so on our website at the bottom in the footer. And then also, if I think all of you made it here because you are subscribed to the VeggieRx mailing list, but just in case you are not, or somehow you've fallen off, you can do that by just directly emailing the address I dropped into the link, and that'll automatically subscribe you to the Google groups that the VeggieRx working group uses. And yeah, just some OCFSN overall updates. We welcomed 3 new leadership team members in January of this year. Penny Feltner from Oregon Coast Fork Watershed Council, as well as Natalie Danielson from Friends of Family Farmers, as well as Delaney Ride from Klamath Grown. So we're super excited about having some new faces. And then we also have a couple leadership team members that are returning. And what is new is we are opening up recruitment for the OCFSN board for 1 or 2 new board members to join this spring. So if anyone on this call is interested, or you know someone who you think would be a really fantastic fit, or just a not even fit addition to food systems work, definitely feel free to share the newsletter with them because that'll have information on how to apply to join our board. And I think my final update will be that one of the really great things that came out of the VegieRx working group this past in 2024 was we were able to apply for and receive CCBF funding, which would launch our HRSN learning collaborative. So health-related social needs. Madeline, if you want to come off camera real quick, Madeline is the coordinator for that group. And we're super excited to have her. And we just had our first learning collaborative meeting, which earlier this month, and it was made, right now we have 15, is it 15 or 16 organizations that will be going through.
Yeah,
Go ahead, Madeline.
16 organizations, but there's a couple of people from like multiple people from organizations. So we've got about like 26, I think, or 24 participants so far, which is really great. And it was a great meeting. It was great just to get to know people and start planning for the future of what this cohort is going to look like in the next coming year. So yeah, nice to meet
Thanks,
you all.
Madeline. Yeah, and it's also been a great collaboration with the CCOs, with Trillium, and also with Care Oregon. Thanks, Kaylee. It's been really great just being able to get the updates as, things are changing, as the benefits roll out. So one of the great things there is for folks who weren't able to join the collaborative, we are planning on being able to also feed through to this group all the updates that we're learning as we're learning them as well. And I will pass it back over to Claire.
Thanks, Shin, and thanks, Madeline. So really quickly, we wanted to reintroduce the steering committee members. And I am now remembering, I think that Trin is actually out of office today and not able to join us. So I might just reread her bio that is on the VeggieRx website. But Theo, can I put you on the spot to go first, just with a really brief kind of introduction?
Please put me on the spot. That sounds great. My name's Theo Latta. I use he and him pronouns. I'm the Director of Indigenous Health Equity for OHSU Health. I also oversee the Medicaid, Medicare program within the Clinically Integrated Network and Integrated Delivery System for OHSU. My background is in culturally specific nonprofit work mostly. I'm also a researcher by training, and I've worked in a handful of different educational institutions, including school districts in the Department of Education, as well as in local government at the City of Portland. But I'm super pumped to be here, and yeah, hope to get to know you all more.
Thanks, Theo. I'll jump in next. So my background is in food systems. I've held a lot of different roles, a lot of institutional procurement, both in farm to school and kind of other farm to institution, including VeggieRx. And I'm always interested in unique opportunities to both increase food access for those who might not have access to locally produced foods, and market opportunities for small scale producers at the same time. So my current role is also with OHSU. I work with the Oregon Rural Practice-Based Research Network, and I manage contracts with OHA, including some technical assistance around the health-related social needs, 1115 waiver, mostly, yeah, putting on technical assistance, developing guidance around state policy. And yeah, I'm also excited to be on the steering committee. We're supporting Kaylee in managing this work and creating collaborative opportunities with you all. And then I'll read Trin's bio really quickly. So Trin has experience working with Rockwood Community Development Corporation, where she supported BIPOC farmers in Boring, Oregon, by helping them sell their produce through school meal programs and farmers markets. So a lot of that farm to institution connection. She's passionate about using food as medicine and enjoys spending time in her summers tending to her herb garden at home. So you'll see Trin and see emails from her as well as Theo and I. Okay, I might hand it back to you, Theo, to just have a brief presentation, whatever you would like to share about the Towards Health, Towards Wellness, or other titled program. And if you'd like to share a screen, let me know. We can make sure you have screen sharing power.
I would like to share screen.
You're good to go, Theo.
Okay. Let me try to bring it up. I'm sorry, I'm not the most familiar with the Zoom. I think WebEx has ruined my life in this regard. But hold on. Let me figure it out. I'm gonna give up, and I'm just gonna talk to you about it. So myself in this position that I have at OHSU, sometimes you're required to wear a lot of hats. Those of you in the community-based organization or the nonprofit world are all too familiar with that. Again, my background has mostly been in Native American nonprofits, but I think and I believe that there is an opportunity for partnership with community-based organizations and places like OHSU. So myself and Dr. Lea Warner, who's a physician on the team that I'm with, we are building a program that Claire alluded to the title of it. We don't have a full title. We have like working titles. So right now it's like Toward Healthy Lifestyles Initiative. It's also called Building Community Around Wellness and Health Span. And part of like the vision is to create like a community where folks are empowered through culturally grounded resources and genuine partnerships and community-led and sustainable programs that address root causes of disparities. As many of you know, Indigenous populations in this country sometimes have the worst health outcomes of any other racial demographic, but it's not just a racial demographic for Indigenous people. As members and citizens of sovereign nations, we're also in unique political positions. So we wanted to create a partnership with a variety of different organizations as well as tribes to enhance well-being and start with Indigenous people, right? So this could happen, and we have built this program to expand access to tailored exercise as well as tailored nutritious foods and culturally palatable foods, as well as social support programs. So we want to do this while nurturing community-led partnerships and like cultivating reciprocal trust between community members and OHSU health services. So it's a two-pronged focus. The exercise focus is to partner with local gyms as well as community-based organizations like well, I won't mention the names yet, but native specific community-based organizations, but we also wanted to have a nutrition focus, and the nutrition focus is why I'm so interested in bringing this to the group. We want to collaborate with food banks and farmers markets for affordable and fresh produce, and also offer cooking demos, focusing on budget-friendly meals, and implement healthy pantry initiatives. And we also want to develop peer support groups around nutrition-based topics, and doing this all while providing on-site enrollment for Medicaid and health screenings at community events. So like we wanted to positively transform health and wellness in the Medicaid space for Medicaid participants by strengthening and cultivating these relationships. So my ask for the group was if folks know of people, or if folks are here who want to be involved in this project, please let me know. You can reach out to me or email me, or just say hello in the chat. And if you know of somebody that I should be reaching out to further this program, then that would be awesome too. But the end. That is my presentation. That is PowerPoint free.
Thank you, Theo. Does anyone have any just immediate questions for Theo? We definitely have a few minutes if there are clarifying or any details that you want to hear. Okay. Also, feel free to drop them in the chat and we can answer them later. Awesome. Thank you, Deirdre. Okay, so I'm going to hand it to Kelly Randolph with Zenger Farms and Daniel Riff with DoorDash or Project Dash, just to share a bit about a distribution partnership. We know that throughout the state, distribution, especially with the CSA model of Veggie RX, can be really challenging for organizations that aren't kind of centered around that logistics piece. So we thought this might be checking out the chat. Thought this might be useful for everyone. And a reminder, this is being recorded, so and we will send it to folks afterwards. So more people may benefit from this than just those who are on the call. But Kelly and Daniel, take it away.
Hi everybody. This is my first Veggie RX group meeting, so it's nice to kind of finally put some names and faces to all the emails that I have been receiving, and unfortunately have had limited capacity to respond to, but I'm happy to be here. I am also not terribly proficient in presenting on Zoom, but I'm going to do my best here. So I'm going to share my screen. I've got a couple of slides here to share with y'all. Let's see here.
It's a little green arrow button at the bottom.
Yeah.
Yeah, I have to get into full screen mode for it to show up for me. So
Yeah, I see it there. Let's see if I can. Cool. And I think I'm gonna just. It's not quite exactly what I want, but.
If you go to the bottom right of your screen, next to, on the left of the minus button, there's that little kind of, keep going down to the right
Of
your screen. Yeah.
right, of the one that I'm looking at here to the bottom right.
Yeah. On the left of the little minus button, you see that little what are those things called?
like a projector screen. It's like an icon of a tiny projector screen.
Oh, okay.
Yeah, that one.
This guy. Boom. Thanks, y'all. Great. Okay. So, this is my first time joining, I thought I would kind of just give like a quick little overview of what CSA Partnerships is and what we do. And then talk, specifically about the delivery partnership. And I'm going to do kind of like a shallow dive. I don't want to go too crazy on everybody, but So CSA Partnerships for Health stands for Community Supported Agriculture Partnerships for Health. We have been around since, I think it's 2015. Sylvia, who is here in the meeting, was one of the sort of founding folks as far as collaborators in this program. So we're happy to say 10 years later, we're still collaborating. We partner with Multco federally qualified health centers and local CSA farmers to address issues of food access and community health while driving healthcare spending into local agriculture. So for the purpose of, just in case, folks aren't familiar, federally qualified health centers are community-based healthcare organizations that provide comprehensive primary care and support services to underserved populations. So my understanding is that there's an obligation to provide care to everyone, regardless of their insurance status. And most folks are, coming from marginalized communities and low income. And again, we utilize the CSA model, and we always have. No, this is not the right presentation, y'all. What a mess. So I'm going to stop sharing and maybe.
Kelly, do you want me to share? I think I
Yeah,
have your
would
slides.
you?
Yep,
That would be
happy
amazing.
to.
Stream.
Also, I don't know about you, but this has been the longest start of the year. So I'm
This
just
is
really
so
glad
funny.
everybody made it here.
Yeah, it's funny. I had this all queued up this morning, and now I'm all messy.
Does that work on the partner clinic slide?
That's fantastic. Thank you
Great.
so much, Daniel.
Sure.
What a pro. So these are our current partner clinics. We have community health workers at each clinic who are our liaisons to the clinics, and they are wonderful. They're a huge part of our partnership. So as you can see, we have sort of a kind of wide sort of swath of clinics across the county, ranging from all the way up in sort of St. John's to all the way out in Gresham. And again, the way that people enroll in the program is through referral from their medical providers and from the community health workers who are the liaisons, again, from the patient team to the program. And they tend to be sort of representatives of the communities they serve. So their relationships are really important between the participants and the community health workers. Up to the next slide for me. Thank you. So these are our current partner farms. One that is not pictured is one of our winter farms. This is just sort of the main season farms from 2024. We're partnering with Happiness Family Farm. They're up on Savi Island. Lomita Farm is out in Boring on Headwaters, which is sort of like an incubator farm. Gonzalo from Lomita was one of our apprentice farmers from Zenger Farm the year that I was an intern. So it's great to still be working with him. Full Seller Farm is out in Boring, Oregon, kind of on the Gresham-Boring border. And then Zenger obviously is a participating farm and probably always will be by virtue of the partnership. Next slide, please. So I thought I would talk just briefly about the sort of demographics of our clients. I didn't include any of the sort of ethnic or racial demographics for the purpose of this. I just thought we would talk about, access. So most folks, as you can see, are, we've got household sizes ranging from like 1 or 2 up to, families of 8, sometimes upwards of 8. So we've got kind of a range of household sizes here. But we asked in 2024 what the annual household income of most participants was, and you know, more than half of those households are living on under $15,000 a year. So it's a pretty low income demographic that we're looking at, and everyone is under $50,000 a year. So this access is pretty crucial. Next slide, please. I think everybody knows about us that we are working, I'll get to it, but we're working largely with insurers as our funder at the moment. So most everyone is eligible for Medicaid. They receive that through Care Oregon, the sort of CBO that, or CCO, excuse me, that is the arbiter of those funds. We also have a handful of Trillium clients, and those are also eligible for what we call flex funds, which I'll talk a little bit about. We also have a sort of group of folks who are not insured, or on or underinsured, and we usually are able to find ways to cover those gaps without too much trouble. Usually grants, or sometimes we'll get some support from CCOs to support those folks. Next slide, please. Okay, so I'll talk a little bit about the history just because it's pertinent to the journey that brought us to DoorDash. So in I believe it's 2015, the collaboration started between, and Sylvia, correct me if I'm wrong, but I believe it was through Mid-County Health Center and Zenger, just the two, the one clinic and the one farm. I think it was sort of identified as a potential collaboration by the then farm manager of Zenger. And it started as an in-person model, as a sort of like a CSA, but it was a pickup, and it was sort of like a market style. Folks would come through and talk to their community health workers, talk to their farmers, and pick up their veggies. And that worked for several years. And then, as we know, and that was sort of funded by folks were using their SNAP benefits, and there was a copay, and sort of that. My understanding is that there were some grants that covered gaps there, but for the most part, it was sort of like a SNAP, largely SNAP based payment model. And then they scaled up to partner with more farms and more clinics. We got up to almost, I think 9 was the upper limit of clinics that we had, and 5 or so partner farms. And the farms would usually be relatively close geographically to the clinics, and the farmers would come to the pickups, and that was the model. And then 2020, COVID happened. We pivoted to kind of not on a whim, but sort of based out of necessity. This is when I joined the program as an intern in 2020. We sort of pared down to just the original clinic and the original farm. So it was just Zenger and just serving the Mid-County folks. So there was just about 60 folks receiving shares at that point. And it was just one intern, me, and one program manager. And we were packing shares, and community health workers were delivering them. And it was very like grassroots. And it ended up working. But that obviously was not a scalable model. We couldn't have folks just kind of running around doing that all day for when we scaled back up in 2020, went back up to our 300 participants that we were serving pre-COVID. So when we did that, we were using interns, and sort of like, it was 2021, it was still COVID, folks still had time. There was still a lot of momentum to, for folks to kind of get out and support the community when, there were other folks that weren't able to get out. And again, that worked for a season. But we realized that, as a lot of nonprofits did, that you kind of can't build a model on volunteer labor, and it wasn't equitable or sustainable to continue using stipended or volunteer labor for that. So that was a consideration. And then in 2022, as a group, we kind of decided, well, maybe it's time to go back to an in-person model. It sounded like folks were kind of missing that in-person component of coming and getting their veggies and chatting with their care team and the farmer. So we tried kind of going back to the pre-COVID model, and what we found was that there were a lot more barriers than maybe before. The turnout was not quite as high as it had been in pre-COVID. I think, anecdotally, we heard lots of folks during COVID, with a lot of, folks buying homes and, kind of creating, there was a fair bit of gentrification that happened in Portland. So folks had been kind of pushed out further than their local clinics. They weren't as central anymore. Obviously, the same issues of mobility and transportation and all the things that have affected people before were still present and maybe more acute. And folks had gotten kind of used to the delivery model. It really worked for folks. It kind of met them where they were at. So 2022 was kind of a weird one, but we ended up in 2023 going back to delivery and realizing that, again, we needed something scalable. So enter DoorDash. So actually one of the then sort of leadership team members, Lea from OHSU, who has since moved on, but she brought the Project Dash information to the program team and we ran with it. And here we are. And also I should mention during this time from 2020 to 2024, because of the body of evidence that the team had built, in previous years, we were able to utilize flex funds, which are sort of insurance funds that cover things outside of medication, to pay for a lot of the program costs, largely the vegetables, but to an extent, some of the operating costs. And then there's just a little bit there in 2025 where, as everybody in this group was probably still thinking about in 2025 and beyond, as far as funding, we're not sure what's going to happen with the 1115 waiver and the HRSN thing. We're kind of still waiting to see how that all rolls out. But as of now, we're still working with flex funds to kind of cover the program operating costs and some of the costs of using DoorDash to operate the model. Next slide, please. So the partnership has been fantastic. And we'll, I'm sure Daniel will get into more of like the actual details of what that entails, but largely we are able to upload a template of names and addresses, and we have Dashers show up and it's super quick and easy. The one thing that was different to our model once we started partnering with DoorDash is that, with intern labor, we were able to sort of hub everything out of Zenger because we could just kind of send folks to all over the county from Zenger. And that was sort of where we had our operations based out of. With DoorDash, there is a 10-mile radius within which they will deliver from the pickup location. So what we had to do was figure out what the most appropriate locations would be to distribute from in order to capture this sort of wide swath of folks that we were serving from, like I said, from St. John's all the way out to, Troutdale, Fairview, Gresham kind of thing. So what we did was we chose some central functional locations. Zenger is one of them. We chose, and I'll get to this in the next slide too. We chose one in the north and one in the east and one kind of in the middle in the southeast, where again, there's large concentrations of folks. And for the most part, we were able to capture most people. The folks who don't fit into that sort of radius are few. And we do give the option of coming to their home clinic to pick up their share. And that is made possible by the collaboration with the community health workers at those clinics. But for the most part, everyone is able to, not everyone, most people are able to receive their deliveries weekly in the winter, weekly in the summer, bi-weekly in the winter, without much trouble. Next slide, please. Yeah, so we decided that our hubs would be, like I said, Zenger Farm, which, as we know, is out in the Lentz neighborhood. North Portland Health Center is squarely in St. John's, so that kind of serves that sort of north quadrant, that fifth quadrant, I guess we say. And then Full Cellar serves the sort of the East County kind of folks. And there's quite a lot of crossover between Zenger and Full Cellar as hubs as far as the catchment area. If you could pop to the next slide, I'll show that. So that yellow pin is the North Clinic. Most folks kind of reside on the sort of more Portland side of that circle. So most of the deliveries are going pretty close to the clinic, actually, pretty close in. But it's far enough from Zenger, which is that red pin, that we aren't able to distribute from Zenger to any north folks. The green pin is Full Cellar Farm, which is located in Boring. And as you can see, there's sort of like that little Venn diagram sort of converge there. And that's where a lot of the concentration of participants live, is sort of in between those two areas. So like I said, for the most part, it's been very successful as far as catching all of our clients. And the collaboration has been really wonderful. The technical support's great. It's, again, I'll leave it to Daniel to talk more about all of the actual, but as far as like solving logistical issues, it's a great partnership. There's always a lot of support. So that's kind of the background of where we are. And then I'll let you take it, Daniel. Thanks again for bailing me out on that tech thing.
Happy to help. Thanks, Kelly, and thank you, Shin and Claire, for having us present on the call. Would love to open up for questions after I talk through a few slides. Questions for Kelly, questions for me, but excited to talk about this partnership. My name is Daniel, and I lead the government and nonprofit operations team here at DoorDash. So we work closely with all types of community-based organizations around the country through Project Dash, which is where, like Kelly talked about, nonprofits have the ability to tap into the DoorDash platform to do deliveries, to get food and even other items to folks in their community at scale, when there may be, it may be a struggle to get those deliveries out to the community through other means. I am based in New York, but I am actually in LA today, so I am joining you on Pacific time. So I will jump into a few slides to give an overview of how this works, and then again would love to take questions. Often we get the question of why is DoorDash doing this and what are we doing in this space? As a company, we believe delivery is essential for all types of organizations. That is true for restaurants, as you may have seen, may have experienced as a customer on our app. It's true for pharmacies. It is true for grocery stores. And we believe it is also true for nonprofit organizations, where the essentialness of delivery there looks a little bit different. In this case, it is more about ensuring that people have equal access to resources, whether or not they're able to access them in person. There are barriers like transportation, there are barriers like stigma, there are barriers like Kelly talked about where it may be interns or staff who are doing deliveries, and it is just a really hard operation to scale and is not typically a core service or competency of many nonprofits, but one that they know is important to really serve their communities fully. And so through Project Dash, we have done more than 6 million deliveries since 2018. That amounts to more than 100 million meals, because many of these are, large produce boxes, where there's a lot of food going out at one time. And the team that I lead, we are very specialized in learning and understanding the needs of nonprofit partners around the country, and produce prescriptions and similar types of programs is a very common use for our service. This is a fraction of our partners across the country, but I just wanted to show the map to give you a sense of who we are working with today. We work with a lot of food banks, roughly a third of the Feeding America network. We work with a lot of Meals on Wheels organizations, typically as a backup service when they may not have volunteers or staff drivers that can do their routes. We work with a lot of United Ways, and increasingly we work with a lot of organizations doing produce prescription type services around the country. In Oregon, this is a very funny looking map, but this is what our coverage maps look like here at DoorDash. I just wanted to put this up on the screen to show you where our service is active. Anywhere that is blue is where DoorDash is active in Oregon and where we can have drivers pick up from. Typically, that is any community of at least 5,000 people, and often communities that are smaller than that. I also just put up some of our current partners in Oregon. that we work with on a regular basis on different types of programs. But we are more than happy to, if you are interested, zoom in on your area and share in an email after exactly where DoorDash is operational. So we do many types of deliveries. In many cases, it is groceries, produce. We also do things like prepared meals. We deliver for government programs. We have partners that are diaper banks. We also do some food rescue. Some of that middle mile distribution too, we'll sometimes do for partners if it is a relatively short distance in terms of getting the food from the supplier to your location. And then in terms of the radius, we have a 10-mile or a 15-mile option. So Kelly talked about the 10-mile option that we have. And then we have, for a slightly higher rate, we have a 15-mile option as well to get a little bit farther out. I'll talk about that more in a sec. But pickup points are as limited. Kelly talked about how they have 3 partner sites or 3 distribution points in their service area. Sometimes it is just 1, sometimes it is 20. Sometimes they are a partner agency like a clinic. Sometimes it is a truck. All we need is a fixed address to have the drivers come and pick up from. And then just a few of the common use cases. A lot of senior programs, pretty obvious given that population, why delivery is very essential for that group. Healthcare partnerships along these lines, and also on the food bank side, we do a lot of sort of partner agency distribution. And I'll mention just in terms of some of our partners may have some vehicle capacity, but often it's the scale that is really difficult to do without a delivery partner. In terms of how it actually works, all our partners have to do is provide a list of who should get the delivery, when it should be picked up, the person's contact information, any drop-off instructions. You can even choose how quickly you want dashers to arrive. Let's say you have 50 deliveries you want to get out. The dashers will probably pick up 10 each to make these routes really efficient. But let's say you don't want 5 people there arriving at once. You don't have space or staff for that. We can space it out. And then those orders just go out to local dashers or drivers who are online. Often when these are a regular cadence of deliveries, you start to see the same dashers over and over again pretty quickly, who are used to the folks that you're serving and the program that you have, and kind of seek out these deliveries. And then you can actually track all of these results in the DoorDash portal. So you would have access to the same system that any DoorDash partner has to track their deliveries, portal that updates in real time. You can click into any order, you can contact the dasher if you need to, you can see where they are on a map. It's very user-friendly and something that we continue to improve all the time. Now I wanted to talk a little bit about the 1115 waiver, since I know this is a thought, something that is top of mind for many of you. And we work with organizations across the country that are can operate as nutrition service providers under 1115 waivers as more states come online. So for states that have funding through Medicaid via 1115 waivers, the reason that we see a lot of organizations partner with us, one is to quickly and easily scale. If it is a active 1115 waiver and there are referrals coming through from healthcare partners, it is tough to fulfill those referrals if the referrals are for delivery and you don't have much bandwidth yourself to do those deliveries. And so I'll talk about North Carolina as an example. North Carolina was the first state to have 1115 waiver for nutrition supports. We have about 5 CBOs that we work with there on their 1115 waiver program. What we saw from many of them is that they were, they built up their operation to be able to fulfill referrals that were coming through. And they assumed it would be some pickup, some delivery for food boxes. And they saw more than 95% of referrals coming through for delivery. And they did not have the capacity for that. They assumed there would be a lot of pickup. And then what they saw with the small number that said they would pick up was they did not come to pick up. And so our partners purchased the food, got the logistics in place to get the food, and then did not get reimbursed for that service because the folks did not come to pick it up. And so several of our partners actually moved to delivery only because they could ensure they would be able to provide that service. It was more accessible for the client, and it also ensured they would get the reimbursement. And so we've seen a lot of organizations. We're seeing some of the same shift in California as well, where we have several partners that are tapping into the waiver through CalAIM there. For the same reason, the delivery ensures that everything works a little bit smoother and the reimbursement flows through. So I mentioned a couple of these states that we're working in today. We're also New York. They just began implementing their waiver last month. And so we have some partners who we've been working with that are now going through the process of they've contracted to be part of the network there, and then they will start getting reimbursement for providing nutrition services. We see a mix of partners that are doing this with groceries and with meals. So I'm in LA today. I'm actually visiting a partner in LA in a couple hours that uses us for their CalAIM program under the 1115 waiver. They have primarily volunteers, but when they don't have volunteers, when they are short on volunteers, they use DoorDash to get those deliveries out, which is pretty common. And so I'm also happy to answer any questions in terms of what we're seeing across the country. But we definitely see much more necessity for delivery and actually making these programs work than people might think upfront when they're doing their initial planning for them. And then just in terms of what our partnership structure looks like, we contract directly with CBOs, and then our partners get monthly invoices for deliveries that they complete with us. And under the waivers, it looks a little bit different in every state. We'll see how it kind of develops in Oregon. But typically, we contract with the CBO. The CBO submits a claim for reimbursement, either through the health plan or through an intermediary organization if those exist in Oregon. All right, so pricing. We offer a discounted rate for nonprofit partners. We do not profit on Project Dash. This is something that we do because we are excited about the demonstration of how delivery is essential by what we can do with our nonprofit partners. It is the best illustration that we can be doing. And so we do have pricing here. The vast majority of this goes to Dashers in your community to do these deliveries. But we offer low rates to try to make this affordable for our nonprofit partners to be able to serve folks in your area. So we have a few options that I'll talk through. It basically is a matrix based on the amount of food you are sending. Typically, when it is a produce prescription box, it is standard. Those usually are not more than 25 pounds. And then in terms of radius, again, you have that option. So let's say you are sending one produce box and you want up to a 15-mile radius from your area. That is a flat $5.95 rate. We try to make this predictable so that you can more easily budget for it. You know what you're going to be invoiced for. We don't have other fees besides this. We try to keep it very simple. And generally for DoorDash partners, on the for-profit side, our rates range from about $7 to $11 per delivery. So this is a pretty heavily discounted rate for our Project Dash nonprofit partners. And then happy to, if anyone is interested, happy to discuss this more about what this would look like for your organization, or if it's not even something like today, but maybe you're thinking about this for the future, also happy to talk about that as well. We have a no obligation agreement. We have partners that use us, maybe 6 months on, 6 months off for seasonal programs, whatever it may be, not a problem. But would love to see if we can help out with any of the work that you all are doing. And that's it for us. We'd love to take any questions.
Yeah, we've got about 8 minutes for questions. And I have one, but I might wait a moment and see if anyone else.
Yeah, I see one question in the chat about tips, which is a good question because often when we were at DoorDash, that is something that we do. So for these deliveries, these are no tip eligible deliveries. So we have certain types of deliveries that are on the DoorDash platform for Dashers where tip is just not an expected part. Like a pharmacy delivery is another one where people are just not accustomed to tipping for those types of orders. So for our Project Dash deliveries, because of the efficiency that Dashers are doing these at, they can pick up 10 and then do a single delivery run instead of going restaurant delivery, restaurant delivery, restaurant delivery. They make roughly the same amount per hour as they do on tipped restaurant deliveries. So we communicate to them up front, there is no tip for this order. They see the total amount they're going to make, they see how much time it's going to take, and they can accept or decline it. But we look to make sure that they're making about the same amount per hour as they would on like a tipped restaurant order. So there are no tips for these types of deliveries. I see we got a few other things in the chat too. Awesome, thanks, Madeline. Glad to hear that the participant feedback was very positive. And I imagine that's mainly for Kelly.
Looks like it's for me as well.
Yeah.
Let's see. So how does the billing for insurance work? So right now, the way that it works is that we are working with what we call flex funds. That it is subject to change with the sort of implementation of the HRSN and the 1115 waiver, but we kind of have a contract with Care Oregon, and we haven't agreed upon rate at which we sort of reimburse per participant. And so we are able to utilize the funds from that to cover the costs of DoorDash deliveries. So we don't bill insurance directly. We receive it as a reimbursement as a part of the participant's participation in the program. Does that make sense? Let's see, doing a minimum. Okay, great. This
I will also
probably for you, Dan.
go ahead, Kelly.
No, go ahead. I was just thinking this next one might be for you.
Cool. And I also just dropped my email in the chat too, just so people have that if you are interested. Is there a minimum number of deliveries for this sort of work? There's no real minimum. The only thing that we ask is that when you are scheduling deliveries to be picked up from your location, that you have at least 5 that you're asking to be picked up. That's so that we can have a pretty good set for a local Dasher to pick up, and again make it really efficient for them. But in terms of like, do we have minimums on an ongoing basis? We do not. We do serve as a backup for a lot of partners, so they may go a month or 2 without using us, and then their vehicles in the shop or their drivers out that week, and then we fill the gap. So there are no kind of ongoing minimums. We just want to make it appealing to a local Dasher when they come to pick it up each time. And feel free to come off mute too if there are other questions.
I'm trying to type this out. This is probably easier just unmuted. I'm doing some rough calculations in my head right now in terms of the HRSN nutrition benefit and the proposed fee schedule for fruit and veg benefit, which is that fee schedule. There isn't a transportation fund outside of the reimbursement rate for just fruit and veg benefit. And so I guess this is more of a question to Marci, to Kelly, to folks out there that are looking at Madeline, looking at becoming HRSN food providers under the HRSN, 1115 waiver, and how you imagine if, going with DoorDash or some other delivery system, as well as actually paying for the fruits and vegetables and your staff time and all of the things.
Well, this is the first time I've heard of this as being even an option, so I think it's pretty cool. And I was really curious what that little triangle swath was in Eastern Oregon. It looked like it might be like John Day area. I don't know. I was just really curious about that. But this is the first time I've heard of it. I think it sounds really great for any CSA programs or the Commodity Supplemental Food Program. Meals on Wheels programs, I think this could be quite amazing. There would potentially be some funding through the Older Americans Act. I think you could probably work things around there to make the delivery worth it. So that's all I'll say on that.
And Marci, I will add, for the Commodity Supplemental Food Program, we do delivery for that program in 20 states today. I do not believe we do it in Oregon, but would love to if there's opportunity to do so.
I guess, Kaylee, I can say that as you kind of saw from, the slide that talked about where most of the folks or most of our participants are with their insurance coverage, we're largely working with Care Oregon. And so as of now, we're actually not quite sure how things are going to change when it comes to rolling out the HRSN benefit. For the purpose of this year, we're kind of operating similarly to last year, as far as just having a contract and working directly with the organization, just kind of providing the number of participants and receiving reimbursements that way with the agreed upon sort of rate of participation. So yeah, we actually don't really know how things are going to change, but we're kind of working on that as far as just like trying to attend sessions and having conversations and just figuring out what's next.
And I'll add, just from what I've seen with the rates and whether transportation kind of fits or not. I know in North Carolina, there is a supplemental reimbursement for transportation. I think that, but that has not really been the norm with what we've seen elsewhere. But generally, in most cases, our fee has been able to fit into the reimbursement amount that a CBO can get. I know in New York, there's a reimbursement range. And if it is a delivered service, then it gets reimbursed at the higher end of the range. So we've also seen that approach. And we do have some partners in California where it's similar to probably the structure that you all will have, where it's up to a CBO to negotiate a reimbursement rate with a health plan. And there, some of those reimbursement rates are very low. We are still seeing partners partner with us, even when the reimbursement rate is in the 40s or 50s, because it is a scalable way to be able to provide the service. But I know it is tougher when the rate is so low.
So I put in the chat that SHARE is supporting Health for All through reinvestment, and it's required of all coordinated care organizations in the state of Oregon to set aside funds specifically for that. I don't know how it works at other CCOs, but in Eastern Oregon, we have an annual application process, which is open right now. But I think that this type of a project, if somebody were forward thinking on it enough, could potentially apply for it and then apply to use the share funds as that to cover the fee delivery or the delivery fee.
All right,
I,
sorry, go ahead.
I see a question from Grace. Just a quick response on that. It is $4.95 per order. So if there are 5 orders in the delivery route, then it'd be about $25 for that set of orders.
We're about at time, but I also don't want to cut off conversation because this is like equally as meaningful as our project share out. But thank you so much, Daniel and Kelly. Feel free to, it sounds like, send Daniel extra questions. He dropped his email in the chat. And then Kaylee, you might have a more in-depth response to Megan's question about the reimbursement rate for Veggie RX. What I know so far is that it has not been announced, but I can drop a link to all of the other reimbursement rates for all other currently rolled out HRSN services in the chat, which is not applicable directly to Veggie RX, but might give you more of a sense of what might be coming down the pipe at some point in 2025. Cool. Thanks again, Daniel and Kelly. You're welcome to hang out and listen to some program updates, but also if you have other things to do on this Tuesday morning, you can feel free to hop off the call.
Thanks all. Appreciate it.
Thanks for having us.
Thank you.
Okay. So Marci graciously agreed to just give us kind of an overview of the Frontier Veggie RX program. One of the pieces of feedback that we gathered from the listserv and registrants in August was that you'd like to hear more about other programs in the state, details of how they're operating and an opportunity to share successes and ask for support from the group during these meetings. So we're trying to build some of that structured time in. So Marci's going to share, and then we'll have maybe 15 to 20 minutes after that for anyone else to share program updates and asks for the group opportunities for collaboration and questions for Kaylee, our coordinator, and our steering committee team. So I'll hand it to you, Marci.
Thank you so much, Claire. Thanks for asking me to do this. You know how much I love talking about the Frontier Veggie RX program. So if anybody needs me to talk anytime, I'm there. I'm happy to do it. So currently, I work for the Eastern Oregon Coordinated Care Organization. We serve the 12 Eastern Oregon counties, and the Frontier Veggie RX program serves 7 out of those 12. My goal is eventually to be serving all 12. So it's just a matter of building every year. Currently, we have 435 households who are receiving the program. And the smallest program that we have is in Baker County, and it's about 35. And then the largest ones we have, there's 3 of them that are right at about 80 households. So there's all of the members then in those households. The population we serve is about 50% EOCCO members, so people who are on the Oregon Health Plan, and about 50% of the people who are have other insurance coverage or no insurance coverage, whatever the case may be. We utilize paper vouchers in 4 of the 7 of our counties, and we have those printed up as needed from a local printer in the Dalles. Malheur has a printer there that they use specifically, and then the booklets are then shipped out. We do booklets of 15 vouchers, and each voucher is worth $2. A household of 1 gets $30 a month, and a household of 2 plus receives $60 a month. And it is a year-round program. So we start October 1st is our grant year. That's when share funding is received, and then we go until September 30 of the following year. We currently, for the other 3 counties, we utilize the IQ Pay system, And it's just getting better and better, and I'm loving it more and more. Every time I log in, there's like something new that they're doing, and it just works so much better each time. It's about the same cost for, it's actually a little bit cheaper to use the IQ Pay. There is a monthly push fee that's $1.90 per offer push out to each household served. The booklets are $1.17. But if you think 2 booklets a month that they receive, then that's I'm not a great mathematician, so about what, $2.30. But for a $60 single push, it's still just the $1.90. So it actually, in the long run, works out better. We started using IQ Pay because Safeway and the Albertsons companies, that's the program that they said, we have this, we want to use this, we'll pay for the startup fees, we'll pay for all of getting it set up, and then you can just pay the $1.90 push fees. So of course I said yes. we definitely want to use that. It's been a great partnership with Albertsons companies. If any of you are currently working with them or trying to get an in with them, please email me. I'll put my email in the chat when I'm done. I do have some great connections for Oregon specifically who can help that process. But just know it took me 3 years from the very first email start of trying to find somebody at Safeway who I could talk to, or Albertsons, and then actually finally getting a program on the ground and Lake County was our first county that we used, which was amazing. And it was the first rural program in the whole state of Oregon that Albertsons companies decided let's try it here in this small community first. And now it's available, I know, in all of our 12 Eastern Oregon counties. I think it's available now across the state through IQ Pay. So some of the things that we have been working on, and the other vendors that we use. So our paper vouchers go to some of the smaller mom and pop organizations. And those are mostly in our frontier areas, except for Lake County. And Lake County, the only reason is there's no other vendor there besides a Safeway. So what we're doing to plan ahead for HRSN, that's kind of, I know it's on everybody's mind, the nutrition benefits, and then how the produce prescription rolls out. My greatest concern is the juice worth the squeeze? Is what all this work that we're doing really going to actually pay off and make it really worth all the work that we're doing on this? So we'll see. But what I've been doing is trying to read the tea leaves and determine what all is needed. So a year ago, we added social determinants of health questions into our enrollment sheet. We added the HRSN transition populations as soon as it came out that these are the start of those transition populations. We added that in so that my prescribers are used to answering those questions, so that by the time it rolls around for us, we've got them. We also added health conditions, and we had a few health conditions at the beginning. So we've been operating for over 5 years now, but we've kind of expanded that list of health conditions. We do utilize the food insecurity questions that are standard across the nation, and households have to answer, often true or sometimes true, to one or both of the questions in order to be eligible. It really depends on the county as to whether you have to answer those to one or both of the questions. We do utilize, for funding, we utilize the local community health partnerships, or LCHIPs, And EOCCO sets aside funds for each county that we serve, and it's based on the population of EOCCO members. And so we utilize those funds. In some of the counties, they have agreed to utilize all of the funds. In other counties, they've agreed to use just a portion of the funds for it. The nice thing about it is because we have it already going, it's easy. If a county can't use all their funds, often I will get a phone call that says, hey, we've got, you know, $5,000 extra. Do you want to utilize that? And of course, I always say, yes, absolutely, we'll do it. We use Google as our platform, and it's the professional Google site platform that we use. Our IT did review it and they approved it and our compliance department also reviewed it and says that it is HIPAA compliant, so we don't worry about that. But basically, prescribers, we have county employees, we have people who work at a public health department, at a family care clinic. We also have a volunteer in Wheeler County, 2 volunteers that are willing to be the prescribers. So they do all of that enrollment paperwork for us. The other thing that we do is we do a survey year over year, and it's part embedded into our enrollment. And so people who are returning from years past, we ask a set of questions about, how do you feel like this program is doing? Do you feel like you have better health? Do you feel like you have better mental health? All of those things. And so we just compare that year over year, as opposed to trying to send surveys out and get surveys back. So it's just much easier that way. That's a lot of information, and I talked really fast because I wanted to make sure to get it all in there. So I don't know if anyone has any questions. I've been thinking about the flex funds and how we could potentially access those. But since we receive funds from EOCCO to provide this project, I don't think that we can, on top of that, maybe request flex funds, maybe in the communities where we don't currently have it. But anyway, are there any questions?
Thanks, Marci. I have a quick question. I'm wondering if most program participants are referred by their primary care provider or another like clinical health care professional, or EOCCO directly, the CCO, or if most participants find the Frontier Veggie RX directly.
Great question. So it depends on the county, and it depends on the prescribers. So we have not advertised this program at all in any of the counties. And the reason for that is we do, compared to the population, it is a very small group of people that are able to receive this. So they are many times self-referred because they've heard about it. In Harney County, it's through the public health department and through the family care clinic. So that's how people got started. And then the word about it got out. And so then people self-referred into the program as well. In some of our more frontier communities like Gillum and Sherman and Wheeler, it's really been the prescribers knowing people in the community that they know need it, and getting them started into the program, and then word of mouth ends up, filling it up. But one of the things that I wanted to say is it's really important to message the program in a positive manner for whatever county you are serving or whatever community you are serving. And Mitchell, I talk about the little town of Mitchell, fiercely independent people would not take part in the program when we went there and said, here's this program, you need it. You need it, so use this program. They absolutely not. There was no buy-in. When we changed the language and we started talking about Gabe, the owner of the market there, and how they would be helping him to be able to get more produce in, and have less waste, then they were all on board to participate because it was all about helping somebody in their community. So just think about the area that you're serving and learn like what are their values in that particular community, and it can really help you.
There's another question from Kaylee in the chat. Are you asking the 2-part or 6-part food security, like USDA food security screening questions?
Right. Great question. So we do the 2 food insecurity questions of, in the last 12 months, have you run out of food, or have you been worried about running out of food? So we've been utilizing those. And then I know HRSN stated now that we have to do the 6 questions. So I will be adding that in. I'm not adding it in now, but in October, I'll be getting everybody prepared to be doing that 6-part food security questions. The other thing that we are looking at is the community information exchange, so Unite Us. I'm looking at getting our Frontier Veggie RX program into that platform. And so we are having questions about that because I don't know exactly how we're going to do that, but that is something that we're looking at doing. So there's another question about how people access the produce. Is that for my program, they go to the grocery store and shop for it, especially in those communities that are using the IQ Pay system. It is on your phone that has to be specifically scanned at the store, or you can print out that QR code and scan it at the store. But people do go and pick it up from whatever vendor, and
There's one question from Megan, which I'll read aloud just so it's captured in the recording. Can you speak a bit more about the participant survey you mentioned about how people like the program? How is it administered? We're trying to figure out something like this, and I would love to hear more.
Yes, so we did try sending out the surveys at the beginning and sending them out again at the end to compare them, and we just weren't getting the return on them. People just didn't have time to do that, and it was we were having to do a lot of mailing and like follow up, and it was just not good. So when we found out that a lot of the households participate year over year, we decided to include those survey questions in that enrollment form. So every time that they come onto the program, they have to answer these programs. So every year they would do that. The program is well loved in all of the counties that we serve. Our CCO talks about it. You've hit it big when your CCO talks about the program and shares it as one of their star programs. It's a great program when stores are calling you in these rural areas and saying, hey, we heard about this. We would like to also participate. And then the people who receive the vouchers, who are the participants, they definitely love it because they're able to go to the store and purchase produce that they haven't been able to purchase for a while, or maybe try something new that they haven't been able to try before. So yeah. Did I answer your question? Let's see. I think I did.
Yes, thanks, Marci.
You're welcome.
One more from Nicole. Are you working with farmers too?
So at this point, we do farmers markets in some of the communities, but not most of them. And we do have one mobile market that comes through. It's operated by a single gentleman, and his health isn't great, so I don't know if he's gonna be able to continue there. But most of our communities don't have farmers markets. Especially some of our more frontier. We do allow fresh and frozen produce as well. When we have somebody living in Fields, which is like 3 hours away from Burns, they don't go into town to do a lot of shopping frequently. So we decided to also allow those frozen produce. It just can't have any of the additives in it.
We've got about 8 minutes left in the meeting. And so in case there are other folks on the call that have updates, asks, etc., I want to reserve a little time for them. But thank you so much for sharing so much detail, Marci. I know I always enjoy learning about the real logistics that go into a lot of our programs and understanding the differences. So thanks, Marci. Yeah, thanks, Shin. So everything will be shared afterwards, and I'll make sure to include Daniel's email in that communication as well. But yeah, are there any other updates or questions or things to pitch to the group from other program operators or folks on the call?
So Claire, I did want to say that I've had people from around the state call and ask me about our program, or ask some clarifying questions. So please feel free to reach out to me. Again, I'll put my information in the chat. But I am happy to share any of the information that I have. I'm happy to share our enrollment forms or our rights and responsibilities, anything. I believe in swipe, stealing with integrity and pride everywhere. So if you need something, let me know. Well, if nobody has anything to share, can I see if maybe I can share our tracking form real quick?
Sure, go for it.
I've moved it so that you can't see any of the participants' names. Can you see that okay, or do I need to make it a little bit larger?
It could be a little larger for me, at least in my eyes.
Okay. So these 3 areas here, columns B, C, and D, have to do with IQ pay. And this is what I keep track of for myself to know that I've entered it into IQ pay and that the offers have been sent out. But we track the participants' names. We assign them a household ID. We have the prescribers, date of birth, all of the demographic questions. We ask income, insurance information. This is something we do because of the health-related social needs, and we now are asking for, if they're on the Oregon Health Plan, their ID number, because that's going to be a requirement of HRSN. And then we have the number of adults in the household, and whoops, let me go back here real quick. And we also capture the number of adults in the household that are on the Oregon Health Plan, children, same thing. And then down below, I have my quick numbers that add up automatically for me. So as our prescribers input information, then I can quickly go in there, and for a presentation like this, I can go through and add up all the numbers and know exactly who we're serving. If EOCCO had questions, I could at any time let them know. This years of enrollment then lets us know whether they need to answer the questions at the end. There's the 2 food insecurity measures that we ask, the health conditions. And then we also ask what community food assistance programs they are currently receiving. And then we ask what needs do they currently have as far as their social determinants of health. education, employment, living situation, safety, transportation, utilities. That way, any of our community health workers that are also prescribers can help to connect them. Many of our county employees also provide these services, so they can provide that connection for them as well. And then this is the questions that we ask for all those who are returning participants. So one, did we connect them with additional support resources? Since having the program, do they feel their intake of fruits and vegetables has increased? Since having the program, do they feel their diet has included healthier foods? Since having the program, do they feel that their overall physical health has improved? And then also their mental health, has that improved? And then I track the vouchers that are given to each household, and also the funds that we're spending each month for the households, the number of households served, number of people within the households, etc. So I just wanted to share that because I think that we've got it down to pretty good, so that when households are being input into the system, that we can then manage that and gather information as needed. Yeah, Sylvia.
Thanks for sharing that, Marci. That's a very comprehensive tracker. I really appreciate you sharing all those details. This is not related to what you shared, but I did want to do a quick plug for a food as medicine landscape assessment that we're doing for folks who are operating those programs in Multnomah County and the Tri-County region, so also Clackamas and Washington County. I'm going to go ahead and put the link into the chat for those of you whom this applies to. My apologies for folks from around the state, although I hear it might be coming for the state as well through OCFSN. So hopefully we'll all get a chance to do something like this soon. It is closing this Friday. I know we've reached out to people through a variety of other groups as well. So I know there's probably a lot of cross postings, but if you could fill this out, our intention is to share it back with our community. So we'll figure out how to get this information back to you all, so you have a good idea of who all is operating in this landscape. Thank you.
Thanks, Sylvia. And we can also send this out on the listserv. I know I owe you an email there, so we can send it out that way as well. Okay, well, we're at time, but thank you again to Marci for sharing all that detail. I don't have the next date. I believe it's in May for our next quarterly working group meeting. Shin, do you happen to have it off the top of your head?
It will be May 6th from 9 to 10:30.
Okay, and we'll get a agenda out in advance, further in advance next time. So we hope to see you all then. Feel free to post in the Google group if you need things or have questions or want to share in the meantime. But thanks everyone for joining us today.
Thanks, everyone. Have a great week.